Now to introduce our speakers. Dr. Amy Wisniewski, PhD, is a behavioral endocrinologist with over 20 years of experience in researching gender development in children and adults. And Dr. Stephen Chernausek, MD, is a pediatric endocrinologist with over 4 decades of experience providing medical care to children affected by disorders of sex development, also known as DSD. But these two have a massive wealth of experience, and we're truly privileged to have them with us today. So without further ado, I will turn it over to them. Thanks for joining us today.
Thank you so much, Megan, for that kind introduction. And I'm really happy to be here too. And I think I'd like to start out sharing something with Amy about a recent conversation I had with a teacher friend of mine. It turns out she's a teacher in late grade school. And she just has found out that a student who is a girl in her class is going to be coming back in the fall as a boy. And this is something really new to her. She doesn't have experience in it. She watches the news and she hears all these terms like transgender, LGBT, and she's finding it actually a little bit confusing and she's frankly kind of nervous about the whole thing. So, you know, what could we tell her? How could we advise her about this?
All right. Well, that is a great question to start with because we get asked this quite a bit. I would first say to your friend, just pause and understand that being nervous or uncertain is completely understandable considering the number of new gender terms that have entered our lexicon and how quickly they have entered. So there's always new terms. Even if you have a lot of experience in this field, we're always trying to keep up to date with the terminology. So to be uncertain is a very common thing. So I would begin with that. And the best advice I would give to somebody who is working with children or adolescents, and this is a new topic to them, is I would say, just simply ask the person, how would you like me to refer to you? What pronouns would you like me to use? What name? What I have found is people are very magnanimous. And if they think you are trying to meet them halfway, they will be very appreciative. And the last thing I would want would be for somebody to avoid conversations with youth because they're afraid of using the wrong term. We're always going to make mistakes in our language. So just to simply say to the child or the older adolescent, you know, I really want to respect you. How would you like me to address you? And usually that goes a really long way. So hopefully that would put your teacher friend at ease a little bit.
What about some of these other terms that I've heard, like gender fluid, non-binary? Mm-hmm. What do those mean actually?
Right. Okay, so most of us are used to the word sex. This would be our physical characteristics that are male or female, our anatomy, our hormones, our genes. I'm XX, a male is XY. And most of us are also familiar with gender. Gender is a term that's been used in the medical community since the 1950s. And this really refers to my sense of being a female or your sense of being male. Now, more recently, transgender has been in the news quite a bit. And I think this is a term people are familiar with. And this is this idea that a person's gender does not match their biological sex. So a child who is born female, as in your previous example, but identifies with male would be considered transgender, or a person with gender dysphoria. Now, there are terms that are newer, and people who identify in ways such as gender fluid and non-binary, this is somewhat a new thing to gender researchers in the medical community. So although we have terms for these things, we have a lot less information about these children. So I would again simply say to your teacher friend, simply ask the child what they would like, what terms or what pronouns they would like to have used when addressing them. And I think over time, we're going to learn more about gender fluidity and also people who identify as non-binary.
Okay, this now provokes another thought on my mind about a friend of mine has a young child, like I think around 4 years of age now. The child's a boy, but he likes to play with dolls sometimes, and then sometimes he plays with the trucks and sporty things, and they go and they go. He kind of goes back and forth now and then. So, is he gender fluid? Is that what that is, or do people, like in their infancy, do you start out as gender fluid and then, then find your gender later? I mean, how does it work really?
Mhm. Okay, another great question. So let's go to our next slide and consider some of these ideas. So first off, we don't know if a child is expressing atypical gender if we don't first define what are typical patterns of gender development for boys and girls. And there are actually sex differences between males and females as early as prenatal life, but they tend to be very small and more in terms of motor and sensory processing. So we're really looking at once the child is born and they are developing, what kinds of behaviors would we expect and might make us stop and think, is this child perhaps not cisgender, which would mean their gender matches their biologic sex. So let's start with, when do children develop a gender identity or a sense of gender? And we believe that's around 2 to 3 years of age. 3 might be a bit late. 2 might be more the typical developmental point when we would expect a child to understand gender. Prior to 2, children can tell the difference between male and female pictures, but they may not necessarily understand this concept of gender. Now, why do we think this is developing in children around 2 to 3 years of age? It probably has to do with language acquisition. When children start to learn to produce words, they will learn words like mommy and daddy, and they will sometimes categorize all adult women as mommies and all adult men as daddies. This makes a lot of sense because if you think about it, children are processing so much new information daily that they have to make categories to make sense of their world. So what we think is part of normal cognitive development is children acquire language, and part of that language is understanding categories. And one of the categories that children place people in is gender, including themselves. So they will also develop their own sense of gender at that time. Now, the next thing that we typically see in children is between 3 and 6 years of age, sort of the preschool, early school days. We see children who will exhibit what's called same-sex favoritism. And if people who are listening to this webinar have their own children or grandchildren or teachers, they will have observed that if you put a group of girls and boys together, children at this age will tend to segregate into their groups based on sex. So girls will want to play with other girls and boys will want to play with other boys. That just seems to be part of normal child development. And then finally, what we see in young childhood would be the types of play children are participating in. So in addition to their playmate preference, boys tend to do things like rough and tumble play, what we would sometimes call horsing around. So they will often play outside with large groups in very physically active play that sometimes even looks aggressive. And girls tend to play in smaller, quieter, calmer groups. Now, this sounds very stereotypical. We all know boys and girls who don't necessarily prefer the type of play behavior I just described to you. But we're just saying, generally speaking, if we look at children overall, really cross-culturally, we see these types of behaviors being exhibited as the children are going through early childhood.
You think in the case of my friend's child who occasionally, does what we would call sort of girl-like behavior, that's probably normal, you would say? Is that right?
Yes, I would say that's absolutely normal. Just to give you an example, when I was growing up, all of the kids on my street who were my age were boys. So I played with boys and we played outside. Now, if I had been given the option of playing with other girls my age, I probably would have chosen it, but I didn't have the option. So I played with other boys. And who knows what the long-term consequences of that are. I like sports. I like being outside today. So maybe that had long-lasting impact on my behavior. But it's certainly not an indication that anything is wrong. And children, like adults, are very individualistic. Some people have some behaviors that may appear more female typical, and then at the same time, other behaviors that appear more male typical.
So you're saying there's sort of environmental, cultural piece that sort of goes to this too, what your upbringing was like, or your experiences as a little kid too, that has something to do with it.
Absolutely. I would say that coupled with just individual differences. We all have different personalities.
Got it. Yeah. Okay.
Mhm.
Well, you have this thought. So when should people worry here a little bit, I guess, and is it something that, is happening more often? I think is the other question, I guess. When do they worry? And
Yeah. So that's a great question. I have so many people say, I hear so much about gender nonconforming behavior. Just today I turned on the news and there was a story about a singer. When should we be concerned and what's really going on? So let me first address when should we be concerned. What we tell families is there's no reason to be concerned if your kids are not participating in same-sex favoritism, or they're showing play behavior that's the opposite of what I just described. No concerns unless your child is showing distress from it. When your child is showing distress, that's when we might say, okay, where is that distress coming from and how can we address that? Now, to get to your second question, is this more common today? I'm going to now switch gears to full-blown gender dysphoria, or what some people refer to as transgender. And essentially, we don't know if it's more common today. We certainly hear about it more today. So there's really three ways of thought, or three groups of thought on this topic. One is that we're simply more aware of it. It's in the news, we hear about it, we talk about it, there are all sorts of books. My book club, we just read a book about a child with gender dysphoria. So possibly it's always been this common, and we just are now discussing it in a way that's more open than before. Another possibility is that there is a cause of gender dysphoria that we don't know yet, but whatever that cause is resulting in more children having gender dysphoria today. And people who believe this will point to the fact that just like autism is more common today than what we think it used to be, well, so they would say is gender dysphoria. And interestingly, many children who are diagnosed with gender dysphoria are also diagnosed with either autism or Asperger-like symptoms. So some people say there could be a common cause for both. It's a shared common cause. And the fact that we're seeing more children with autism and more children with gender dysphoria is not a coincidence. And then the third group of thought is that some of the children today who are being diagnosed with gender dysphoria don't actually have gender dysphoria, that perhaps we are overdiagnosing this. We don't know the answer at this time. There is a lot of research being conducted, so we hope to have answers soon. And there could be a fourth option or a fifth that I have not even suggested that may explain some of this. But whether or not it's more common today, we certainly hear about it more today. And so we spend a lot more time, we used to spend a lot of time talking to people in the medical community who were trained specifically to deal with gender nonconformity in their patients. And now we're spending much more time talking to teachers, nurses, people who never came across this before, and parents. And suddenly this is a topic of conversation and they don't feel well prepared to deal with it.
Okay. So I'm thinking now, I'm just kind of recollecting here a little bit. So putting on my pediatrician hat for a moment here, if you have this sort of problem coming up, how do you support, the child and the family, and what are you supposed to do? And I'll first say that this is an open question and there's lots of opinions on it. And I don't think we know all the answers. But one thing in terms of, an issue that's a distressor for the child, the family, I think the first thing is, having it out in the open, acknowledging it, not hiding from it, being kind to the individuals and seeking to understand, what's their perception of it, what's really the root of it. And then maybe going on to decide, do I need a professional person to, manage this further, or to help, myself if I'm a parent or the child deal with it. Things that people do now, there are some medical things that that can support the individual while they're sort of, sorting through the issues of gender. And one of those, you may have heard about, our puberty blockers. So there's a medication that you can give that will basically stop puberty in its tracks. And it was first developed for a problem of precocious puberty, when there are children usually that would have some very specific medical problem, and they would have go through puberty at ages of 2, 3, 4, and 5, and you can imagine what that was like. And these medications were developed for that. They're very effective at stopping puberty, and so in some cases, where there's this clear gender dysphoria and a child is getting the physical characteristics of what they perceive as being the wrong sex for them, that ramps up the stress and anxiety and the I guess I would say that the mental turmoil greatly. So using these medications, you can sort of stop puberty, you can pause that process, you can keep them from developing what could be perceived as physical features that are very undesirable. And then you buy some time in terms of sorting things out. So those things, the medications work very well. When they stop, puberty comes promptly back. It works really well. So they're effective. I think the harder question is in which individuals truly benefit from it. This is a good thing for some people. Maybe it's not always a good thing for others. And I think those are some of the things that are people are sorting out, and it would be a conversation for a different time and a different book, really. Yeah.
But you would say, if parents feel that their child would benefit from puberty suppression, having that first conversation with their pediatrician.
Yes, absolutely. Absolutely. Yep. That's the first place to go. Yep.
And then if puberty suppression is tried and appears to be helping the child greatly in terms of their mental health, what would then be the next step?
Yes. So typically, the recommendations at this age are when a person reaches usually mid to late adolescence. If the gender dysphoria is persisting and the individual strongly desires to assume the features of the opposite sex, then one can give what we call cross-sex hormones, which would be testosterone if a person's a female who wants to transition to a male, and estrogens in the other case. But usually, so I guess I would say I won't say the puberty blockers are totally without harm, because it stops things and people, grow their bones during this time, but it's largely reversible. Giving, sex steroids to someone, either testosterone or estrogen, to promote physical changes, those are, I would say, not easily reversible, and things later on like surgeries are basically almost totally not reversible. So I think, to take those bigger steps, one needs a greater degree of certainty of what the problem is, and a very great degree of certainty, and clear understanding that this is going to help the person. So does that explain it for you? Yeah.
It does. And I would just like to point out for people to know that the Endocrine Society does have a position statement on this. So if people are interested in reading very scientific, detailed information about timing of when to give these drugs, risks associated with these drugs, outcomes to be expected, that is certainly a great place to go. If you go to the Endocrine Society's website, they have quite a bit of information that parents can, and pediatricians can download and read. Yeah. Yeah. So we've talked so far mostly about gender dysphoria or transgender youth, but there are a lot of similar issues that affect children and adolescents who have what are called DSD, or disorders of sex development. And I know you have decades of experience with these patients. So can you tell us something about DSD, something that's not in the news quite as much as transgender?
Yes, yeah, of course. So disorders of sex development, these are very specific medical problems that affect the sexual development and appearance of an individual. They're relatively uncommon, but I wouldn't say rare. And there are many different kinds, but let me give you an example of one. So there's a condition called androgen insensitivity syndrome. So an individual that has that, they have the complete form, they have the chromosomes of a male, XY, they have internal gonads that are male, namely testicles, but from the outside, looking at the person, the appearance is entirely female. And for the most part, sometimes these conditions aren't discovered till a person's, older. Sometimes they don't even, know it. And they largely grow up, with the gender identity of a woman. We would never refer to this person as transgender. You could say, well, is this transgender? Because I've got the, some parts and features of a clinical male, but I'm a female. Or, no, they're not transgender. This is a woman, with androgen insensitivity syndrome. That's what it is. There's, so obviously they have some issues in terms of fertility, but their behavior is, and generally very I'd say along female lines, and their appearances. Another condition.
Can I just interject very quickly? I think that's a great example of showing the independence of sex and gender. So just because a person may have some traits that we associate with male sex, these females are born looking female, they grow up as female, and they identify as female. So that's quite a nice example of showing the distinction between sex and gender.
Yes, exactly. Yes, good point. Yes, I saw a question pop up here too. So is this intersex? And that actually is the former term for disorders of sex development. We don't use it so much now, but it referred to like individuals whose sort of, I guess, the measures of whatever of their sex or the determinants of sex, were sort of intermediate sometimes, or some were a male and some were females. And a good example, another example of this, which I'd like to bring up, is another condition called congenital adrenal hyperplasia. Again, these are affects both boys and girls, but the girls actually have a form of disorder of sex development. And what happens there is because of a biochemical problem in their body, they make too much testosterone from their adrenal gland. And this causes their external genitalia to masculinize, meaning that they'll get growth of a phallic-like structure. They might have a partial formation of a scrotum. They sometimes will look like you can't tell whether it's a boy or girl. Sometimes they're affected so much that when you examine the child, you think the baby's a boy. But they have all the internal sex organs of a female. They can typically, again, most of them have female gender development. With the right sort of medical treatment, they'll have they're fertile and they'll have children. But they do have some behavioral features that I would say lean towards male behavior. Like more often, there's been plenty of studies that show that rough and tumble play is more common in girls that are affected with this. Despite that behavior change, again, it doesn't mean that their gender identity is male. It just means they have this behavior that is somewhat more typical from male. So it's very different from gender dysphoria. Doesn't mean a person who had this couldn't have gender dysphoria, but they're not the same thing. Some of the same issues do crop up, stress and sometimes uncertainty about gender, medical treatment that might be needed to help a person's appearance sort of either be match their gender identity, I guess I could say, and issues that might reflect fertility and reproductive function and their sex life later in life. So all those things The issues are common, but the disorders, the best we know, are very distinct in terms of their origins. Yeah.
Very good.
So, any other thoughts you have on that topic, Amy, or other things, or things we haven't covered in our little webinar so far?
Well, I will say the question that you answered about, is this intersex? That's a great question. Because we did used to refer to these conditions as intersex conditions. So that person is well educated on this topic.
Yes.
And in 2006, a new nomenclature was proposed to the medical community to replace intersex with DSD, or disorders of sex development. And to the person who asked the question, I will let them know that there is a movement to have DSD replaced, and some people would like to go back to the intersex nomenclature. So this is something that pediatricians are discussing right now. I don't know what the outcome will be, but it's quite possible if we did a webinar in 2 years from now, we might be saying intersex instead of DSD. Yeah, absolutely. Just like the terminology surrounding gender dysphoria is always changing.
Yeah.
I think the same can be said for intersex or disorders of sex development.
I mean, you're right. We're kind of deviating a little bit here, but I remember back the term was gender identity disorder first, and that got changed. And maybe you want to give a little history on that or explain that, because people might be interested.
Well, I will say I see a common theme here where gender identity disorder was the official term in the DSM, which is sort of our book for assigning terms to psychiatric diagnoses. And people did not like the disorder part. So then it was changed to gender dysphoria. And I think for many individuals, affected people and their caretakers and people who love and care for them, they similarly do not like disorders of sex development because of the disorder term. So that I think for both populations, a desire to see nomenclature change is that sort of common word disorder. Mm-hmm.
And I think also the dysphoria part then plugged in that, just having a different gender identity wasn't necessarily a psychiatric diagnosis. You had to have encompass some problem that came with it.
Right, the distress that's associated with it.
Yeah.
Absolutely. Yeah. So I think we've gone a half an hour. So if we want to do, I don't know if there are more questions. I can't see the questions, but.
Yeah, I think Megan's coming on to help us. But we're on to the question part now, and looking forward to seeing what everybody thinks. Yeah.
Well, one question that we have is, you mentioned the Endocrine Society being a good resource for parents to seek. Is there another place that you could refer people? Like you said, you've got a child in your classroom, or maybe your own child, or maybe a child within the community who is sort of expressing some of these traits, and you want to make sure that you're respectful and supportive. What are some good resources that parents and community members can turn to?
Yeah, that's a great question. So I would suggest the CDC has as part of their website, a gender terminology page. And I actually check that page because, as we said, new terms are popping up all the time. So I would say, if you're uncertain about the words you're using, or you're hearing other people use, check out the CDC gender terminology. Another group, I think, in terms of more information for gender dysphoria in children and adolescents, would be the American Academy of Pediatrics. So they have quite a bit of information on their website and again, this would even be for parents, general pediatricians. We know lots of general pediatricians who are getting a lot of families asking questions about this. And this was never in their medical school curriculum. So those pediatricians are basically teaching themselves about this topic. And then for DSD, or intersex conditions, March of Dimes has a very nice website that discusses DSD in sort of general terms. And again, I think I see a lot of families, when they have a child with androgen insensitivity, like Dr. Chernausek said, or CAH, they hear about transgender, and so they wonder, well, is this what my child has? And the March of Dimes website will do a very nice job of explaining, no, DSD truly is a separate thing.
Lovely, thank you. Another question that we have in the chat is there a documentary or memoir that you recommend that addresses these issues?
Oh yeah, that's a great question. You mind, Steve, if I take this one?
You can take it. I think I'm going to give a preamble to this. I mean, I
Okay.
think there are a lot of sort of documentaries and things out there, and the situation is different, for many individuals and many circumstances and conditions. So it's a good one, but I think you have to be thoughtful when you're thinking about it. So I'll let you go back and now you can take that one and give a good.
So after that, I have a couple recommendations.
Yes. Be cautious. Yes. Okay.
And I understand why Steve is being cautious, because we see lots of things out there that's very poor quality. So, look at the source of where you're getting your information. But a wonderful memoir about a person with DSD is a novel called Middlesex.
Yes.
It is a wonderful story. I don't know if it's based on a true story or not, but I can say when I was reading that novel, it read true of so many patients that Steve and I have seen over the years. And it's about a person who has a type of DSD called 5-alpha reductase deficiency. So either the author knew somebody who had this condition and did a very good job of describing it accurately, or the author just did an amazing amount of research. And I cannot recall the author's name. I can't recall his name right now, but the book is called Middlesex, and I believe it won the Pulitzer Prize one year. So if people are interested, I highly recommend that.
Somebody put the Jeffrey, you get it.
Someone knew it.
So yeah, it's a guy. I would second that. It's a very true to life.
Yes.
Memoir.
Very thoughtful.
Many of the patients have gone through the same things. Like I say, the person either has it or is very close to someone who has it, I think. So,
or it did an amazing amount of research.
Yeah, I think, yeah.
So that's a high quality story that I know of. For transgender, as I mentioned earlier, the book club that I'm in my neighborhood, one of the members chose this book. I didn't choose it. I hadn't heard of it before, but it was an excellent book. And it was called, This Is How It Always Is. I believe that was the name of it. And again, it was the mother who wrote the book, I should say the author who wrote the book, has a child herself with gender dysphoria. And I could tell by the way she wrote the book, because she was very thoughtful. She questioned a lot of things. And now the book is not about her child, it's a piece of fiction, but just the process of how the characters worked through some of the issues rang very true to me. So I think if people teachers, parents want to read a book that will be very insightful for what it's like to raise a young child with gender dysphoria, I would recommend that book. And I hope I'm getting the title right. I believe it was This Is How It Always Is. I just mailed it to my neighbor, so I wish I had it in front of me, but I think it was excellent. Yeah.
Wonderful.
Nice questions.
Another question we have is a terminology question. Can you elaborate on your distinction between gender dysphoria and transgender?
Yeah. So I say gender dysphoria now, mostly, because that is now, I would say, the term that most people who I talk to prefer. And it's now gender dysphoria in the DSM. But transgender is not necessarily an incorrect term. And I know some people who prefer transgender. So I think this is one of those, sort of what we talked about at the very beginning. You have to, in my opinion, determine the people who you're working with or who you're supporting, either as a parent or a teacher, what do they prefer? But what I see now is most people are leaning toward gender dysphoria.
I would say that's from the sort of the diagnostic.
Yes.
If you ask the person what they, were, I mean, I say I'm gender dysphoria. I think that would be strange. Transgender
Right.
sort of, fits more with, the circumstance, of their life, or their gender dysphoria is sort of the, the term Oh,
The other term I would say is very commonly used with kids now would be gender nonconforming.
yes,
They may not come out and say transgender, they might say gender nonconforming.
yes.
Mhm.
Wonderful, thank you. And then we have a question of, it's a bit of a more serious topic. About 1 year ago, my daughter was touched by a male student at school. She is now stating she's confused about gender and vacillates between wanting to be female and wanting to be male. She didn't display any leaning towards male identity before, and could it now be a result of the trauma she experienced at school?
That is such a good question.
Yeah,
Steve and I were discussing that last night. So I mentioned on a previous slide, why are we seeing so much gender dysphoria or gender nonconformity in the world, right? It seems like in the past 5 years, this is suddenly not an unusual thing for children to be telling their parents and teachers. And one of the theories out there is that we're seeing more children questioning their gender or having a desire to be the opposite gender in response to trauma. And so that's why when I said earlier, perhaps we are misdiagnosing gender dysphoria in some children, not all children. Gender dysphoria is real, but in some children, could we be mislabeling trauma, perhaps associated with an unwanted sexual experience with gender dysphoria? And that is something a lot of people are talking about right now. And so this, again, it would be why when Steve was discussing, puberty suppression and cross-sex hormones, we want to go down that path for the child who will benefit from it, who truly has gender dysphoria. But for the child who is experiencing questioning of gender and their body as a result of trauma, we don't want to go down that path because it would not be helpful to them. We need to address the trauma itself. So I would say to this parent, your thought is dead on. You should be saying to yourself, is my child truly having a gender issue, or is there something else going on? So the people who we tend to see in this group, where we're wondering how to think about this. And again, this is all so new that I don't know that we have answers, but we're just starting to ask questions, would be children who never had a history of atypical gender. So they always played with same-sex playmates. They always played with the toys you would have expected. In the case of a biologic female or a natal female, she always was fine wearing girls' clothes, having a girl's name, and then had a traumatic experience. And now suddenly she is saying she wants to cut her hair short, wear boys' clothes, hates her body. So those are the kiddos that we want to be very cautious with. And again, these are stereotypes. I just say cut her hair short. Well, I have very short hair, right? So just because your girl wants to cut her hair, like that does not mean, we're suggesting she needs medical treatment. But this is where parents know their kids better than anyone, and your child's behavioral history. Yeah.
And I think it is true that sometimes an event or stressor, 50 years ago when all this wasn't out there in the news, the child might have the same sort of stressor, but it would show itself in some different way, in terms of different behavioral, thing. They went, they picked fights with people, or they did things like that, and
Right.
it's could be a response. So I think.
Right.
All right, any other questions? Let's see. Do you think the marketing of gender-neutral toys and clothes helps or contributes to confusion?
I'm letting Amy take that one for sure. Yes.
Although Steve has 4 children and 5 grandchildren.
So
perhaps he has. I will say, I'm going to be full disclosure, I do not have my own children. But from what I have observed from other people's children and just talking to lots and lots of parents, most parents who have told me that they tried to get their kids to play with gender neutral toys, the kids have no desire to do so. And I do think there is, as I said, around 2 to 3 kids have a concept of gender. They're acquiring language. Kids like categories. They like putting things in categories. I think it helps them control all this information that's coming into them from the world. And, kids like sex type toys. And does that mean there's something wrong with that? Maybe that's normal behavior. Maybe we shouldn't discourage it, right? I mean, I don't think we should give our kids guns necessarily, but if our boys want to play rough and tumble, I see no point in discouraging it. And at the same time, I don't think we should discourage a girl if she wants to as well. I don't think we should
look at athletic,
yeah,
like the softball uniforms. They're not okay. The colors sometimes might be a little different between the sexes, but not very much. And I think you're exactly right. That kids gravitate towards what they want to gravitate, to, and what looks like a, feminine, clothes today might not be. I mean,
right. We used to dress our boys in pink.
I know. I used to like
color. Yeah.
I was a child of the 60s. What people dressed like then.
Yeah. I mean, I think our kids get so many gendered messages all the time that they're learning about gender all the time beyond what their parents are teaching them, so I think the best we can do for our kiddos is helping them understand these messages. And yeah.
All right. And we do have another question here as well. Can you speak to the need to disclose versus the need to maintain confidentiality when a child or youth initially comes out as being gender nonconforming? I think many adults feel inclined to immediately tell parents or guardians, but this is not always what the child or youth wants or feels would be best at the moment. What are your thoughts on that?
Right. I think, again, every situation is so individual. I think you really have to see what's going on. Why would the child not want to say something to their caregivers? They may have very good reasons why they don't want to. I would say, are there other reasons why the caregivers, are maybe not supporting the child above and beyond gender? So I think, I think Steve and I are biased because we've had so many families who we worked with where the parents want nothing but the best for their child. They're bringing their child in to see us. They're making great sacrifices to get the child counseling and medical treatment. So I think we're biased in that we tend to see the parents who are really supporting the kids. So I can't even imagine, helping those kids without the parents involved. But that said, there are certainly kids who don't have that, and we realize that. Yeah. So I think
also
again,
part of the question was not just disclosing to parents, but also about, others. And I think this can be kind of a hard thing. How much, where is privacy? I mean, people have rights to privacy in certain ways, and then I think you have to respect those. And Amy's right. We've had parents who really care, but I would say also, if you come back to the DSD world, sometimes in the beginning there's a lot of trauma and the parents are stressed and they're not sure how to tell their friends, grandparents, things like that. So I think these are things that have to be worked through, and I think they're in an individual case. You could see sometimes, well, this is a private matter and it's the best interest of everybody that privacy is maintained, and then in some cases you have to step forward. I think, and I don't think all the professionals are totally settled on on this either. If you have a child who's at a certain stage, would they be better off maintaining some of the the privacy and taking one gender role at home and a different one at school? I don't know if all these things are settled on that, but it's got to be individualized and respecting the wishes of the child, I think, first, really.
Right. And I think, just to kind of clarify what Steve was saying earlier, we spend a lot of time, when parents have a child with DSD, we spend a lot of time helping them be able to explain what's going on in their family to grandparents, friends, whoever their support is, people at church, wherever they get support, because we know that isolation and feelings of stigma are really bad for your mental health. And so what we'll say to the parents is, if you're feeling isolated and you don't have a social support to help you, that's not good for your mental health. And then if parents aren't in a good place in terms of their mental health, that's not good for their children. So that's how we think about it. So we spend a lot of time trying to help people get to a point where they can talk about these things, as Steve said, in a way that respects a child's privacy, but is not secret, and is in the best mental health of the whole family. Because when children are affected by gender dysphoria or DSD, the child is affected, but also the whole family is affected. That the last book I recommended, that's one of the things I really liked about it. The author did a great job of talking about the affected child and also all the siblings and how this affected them. So I think we would hope the family would get to a point where they had healthy communication with people who they trusted, who could support them. That's easier said than done. We realize that.
Wonderful. Right. Any other questions? Does it look like it? Well, I would be remiss if we closed before discussing your publication by the same name as the webinar,
Okay.
Gender in Youth, Biology and Behavior.
There we go.
This is something that came out very, very recently. And am I correct in saying it kind of goes on to do the same kind of clarifying that you've been doing in your webinar today?
Absolutely. And we originally meant to write a book for professionals who work with children like these in medical settings. And we realized from getting questions from friends who were teachers and parents, we realized, oh, we wanted to try to write something that was targeted to regular people, people who don't get training in this, but nonetheless are caring for children and loving children who are, perhaps falling into some of these groups that we discussed today.
And really just giving sort of a very basic underpinning of, what gender is, how it develops, some of the things where a little bit about DSD and things like that. So it's sort of gives the person the basic understanding for a person who comes in, really fairly, cold in terms of their background and knowledge.
Right.
Perfect. So it's a really helpful resource then, kind of wherever you're at in terms of knowledge base then. That's great. Well, thank you everyone today for joining our webinar. Thank you, Drs. Chernausek and Wisniewski, for your wonderful presentation. And if you have further questions for the presenters or about the webinar itself or the presenter's publication, you can contact Maddie at msimmons@kendallhunt.com, but she will be reaching out to you within the week to provide you with the recording and some additional resources. But thanks again, everyone, for joining us, and we hope you have a wonderful day.
Oh, thank you very much.
Thank you. Yep.